Hi, good evening everybody, and welcome to the TFS Health and Safety Reps meeting, which we've convened this evening really just to have a catch up with you all and to discuss a number of things that are happening across the TFS. And we're really pleased this evening to have Janet Newsham, who's chair of the Hazards campaign, with us, who's going to give a presentation on a number of different things that are really relevant in the workplaces during the present time, and particularly with an emphasis on the COVID pandemic. Also pleased to have with us Debbie Court, the TFS member from Santander, Kathy Rhodes, TFS member from Capita, and Julia Upton, who's the Vice Chair of the TFS constituency and also Chair of the Openreach team as well. So we've got these are some of our TFS health and safety members on the committee. And also Dave Dukes has just arrived. Dave is having some technical issues at the moment. He keeps freezing, so hopefully we'll have him with us in a better sense as the sort of evening goes on. But thanks everybody for joining us. And so we've held this session previously, really taking the opportunity with technology to give you some updates on some common themes of what we're dealing with, some of the issues that are existing across the telecoms constituency and the sector that we have members in. And we've got representatives that cut across a number of those businesses here this evening. I'm going to move across because Dave was going to give an introductory session, but I'm going to bring him in later. But as I said, I'm really pleased that we have got Janet here this evening with us, and we've done quite a lot of work with Janet across the trade union movement over many years, and really pleased that Janet's able to join us this evening to come and spend some time with us, and hopefully take some questions as well, Janet, later on as well, I'm sure, as your presentation goes on. So Janet, over to yourself.
Thank you very much. It's really good to be with you this evening, and thank you so much for inviting me. So I'm part of the Hazards campaign. So we're a campaigning organisation, and we campaign for health and safety workplaces and for justice for those who've been harmed by or at work. And I've got a bit of a presentation, I think, if it's going to show. I think April, we're going to share it. Thank you for that. So first slide, next slide, please. So what I wanted to cover tonight is about what the law says about health and safety, a bit about risk assessments, a bit about the transmission risks, looking at a layered approach to controlling the risks, and the controls that need to be put in place for mental health as well, for mental ill health, and then also a bit about working from home. So next slide, please. And thank you. So we start all the time in our presentations to thank safety reps and other reps for the role that you've played during this pandemic. You've kept workers safe. Before the pandemic, we know that workers who were in organised workplaces with active safety reps, you were twice as safe. And certainly through this pandemic, not only have you been twice as safe, but you've kept people alive. And I think it's really important that we acknowledge that, and whatever we can do to support you, we will do. So the next slide, please. So our health and safety laws haven't changed throughout the pandemic, even though the government have issued guidance which has tried to weaken what the health and safety laws are. We'd say that employers are going to be absolutely held to account by the law and not by the guidance. So I think that's something that we need to emphasise with employers, that they need to be taking their risks to your health seriously. They've got a duty to control the risks to your mental as well as your physical health. And we'll look a bit more about some of those controls that need to be put in place next. Next slide, please. Okay, next slide, please. Sorry, thank you. So the Health and Safety at Work Act is the sort of umbrella act that keeps us safe in the workplace. It gives you, it provides the basis for all the rest of the health and safety legislation, of which I've itemised some on here. So we've got the Health and Safety at Work Act, which I said is like the umbrella act. It's the general principles of health and safety. Section 4 of it says that you won't endanger people using that place of work, so our employers haven't to endanger anybody. Section 7 places a duty on employees to take responsibility, to take care, to ensure that they don't endanger themselves or anyone else, which in light of the pandemic means that they have a responsibility to ensure that you don't go into work with the virus and spread that to other people. Otherwise you could be prosecuted under Section 7. Section 9 says that the employer can't charge for anyone for PPE, for personal protective equipment, and that has an implication when we're talking about face masks, because face masks, face coverings are not PPE, whereas face masks would be. So some of the other bits of legislation that's relevant is the Management of Health and Safety at Work regulations, which talks about the risk assessment being suitable and sufficient. There's the personal protective equipment and at work regulations, which is, the standard of PPE that we need. There's things like the control of substances hazard to health regulations, which talks about the chemicals, so it's controlling the risks of chemicals, and that comes to play with cleaners. So anybody that's doing any cleaning, and that would be important that they're trained in that. Provision of work equipment regulations, the workplace health, safety and welfare regulations, which is important through with the control of the risks. The reporting of injuries, diseases and dangers occurrence regulations, which I will mention a bit later on, but that's where our employers are supposed to be reporting if somebody's become infected at work with the virus, or they've died as a result of being infected at work with the virus, or they're ill as a result of the virus. But we know that the Health and Safety Executive have been trying to stop people and certainly dissuade people, or not encourage people, is perhaps the best way to put it, to report under a door. And then, so just on the right hand side of this slide, it talks about some duties. There's an absolute duty on our employers to carry out a suitable and sufficient risk assessment. So it has to be done, and it has to be competent. It has to be carried out by a competent person. And a competent person is somebody who's not only qualified, but somebody who's got the skills and expertise to do it. And in view of the pandemic, we should be insisting that those people have got training on infection control. So do they know what they're controlling? Do they know what they're assessing? Employers must establish emergency and serious and imminent danger procedures. So under Management of Health and Safety at Work Regulation 8, they've got to have already established this for your workplaces. And I know there's lots of talk about serious and imminent danger, whereas under the Employment Rights Act, where you've got the right to remove yourself from a dangerous situation. That's an individual right. So this one on the Management Health and Safety at Work regulations is about a collective approach to it. So our employers should have this in place so that if we come across somebody in the workplace who's infected, or we're put in a dangerous situation because of the pandemic, then we should know what we're going to do. Regulation 10 is that employees must be told about the risks. So it's no good having a risk assessment done and then keeping it locked away in a drawer. That we should all know what the risks are and how we deal with those, and how those risks are being dealt with. And we know in lots of workplaces that's not happening. So it's not just that we're just making this up. There's employers that are refusing to show workers in universities, for example, what the risk assessment says. There's a legal duty for workers to work in a safe manner, as I said before, under the Health and Safety at Work Act, but also under the Management of Health and Safety at Work regulations. And then the specific risk assessments that's mentioned in the Management of Health and Safety at Work regs, and that is for young people, for women of childbearing age, for new and expectant mothers. And then in view of the risks associated, further risks associated with people who are more vulnerable, then there should be individual risk assessments provided and looked at. And those are additional risks for Black and ethnic minority groups, anybody with underlying health conditions, and older workers. So next slide, please. And I would just mention about the safety reps and safety committee regulations, why it's important that we elect safety reps, because you've got rights, you've got enhanced rights to ordinary reps, and that's why it's important that we elect safety reps. We elect more safety reps, and you've got the right to investigate potential hazards, examine accidents, investigate complaints by employees, all sorts of rights under the SRSC regs. You've got, and I think it goes without saying, but I'll say it, is that you need to demand your rights. You need to make sure that you get paid release to carry out your functions. You're not time limited in the functions that you carry out. This isn't facility time. This is a statutory function that you have. Keep an audit trail of all evidence. So if you're demanding things from your employer, if you're if you're querying if there's infections and things like that, keep an audit trail of all that evidence at the moment, because it's going to be down to you. You know, in workplaces where there's no trade unions, then employers are getting away with killing people, in effect, because they're not controlling the risks to their health. Hold your employer to account. So if they're not protecting you, not controlling the risks, then make sure you're escalating it, and escalating to enforcement authorities if it's necessary. And make sure you record all COVID-19 related incidents, illnesses, infections. Make sure you've got your own records of that, because that's something that might be needed later on when the enforcement authorities are involved. Next slide, please. So just taken from the HSC website, still it says about working from home. It says if your workplace is open, you can return to work, but your employer must make arrangements for you to work safely. So that's if you're working from home, you should be doing that safely. They've got to be providing you with equipment, keeping regular contact with you, and there's a lot more information. I'll come on to a bit more information about home working in a minute. But then if you're in workplaces, then they've got to make sure that the workplace is COVID secure, as they call it, and that's with thorough risk assessments that the employers identify people who can't work from home, and that they've put in place proper risk assessments to control the risks. Next slide, please. And this is just an example. So you can go on the HSC website, and it's got lots of information about what they need to control the risk. Actually, I would just say that it's only just recently that they've been putting on some really good information about some templates on there, and that you can look at on the risk assessments. But there are some on there now, so you can look at what they've said they need to put in place. But our employers have to go through this sort of process. They can do it in different ways, but on the HSE website it says employers need to identify the risks, the hazards, decide who might be harmed and how, evaluate the risks and decide on precautions, record the findings and implement them. So it's record the findings if you've got 5 or more employees, but in our workplaces that will be in all those workplaces. And then review the risks assessment and update it if necessary. And in some workplaces they'll be doing that daily, weekly, fortnightly. They'll be doing it as often as need be to make sure that those risks are being controlled properly. And what we are finding as well is that in some workplaces they're deeming infection of COVID to be a low risk, and that certainly isn't the case. It should be a high risk in most of our probably in all of our environments, and so we shouldn't be fobbed off say that it's a low risk, so it doesn't need proper control. It's a high risk. If you catch it, then you can die as a result of it. So it's a serious and it's prevalent in our society at the moment. So make sure it's not deemed to be a low risk. And the next slide, please. So this is a whistle-stop tour of risk assessments, by the way. There's lots of courses out there, and I think in your union, in the CWU, but in TUC, that'll go into this in a lot more detail over a long number of weeks, and actually to get you up to speed with what it entails. But when the employers have identified what the risks are, then they control them by going through a control hierarchy, a hierarchy of controls. So first of all, they should say, can that risk be eliminated? So we stop doing that job, and that eliminates that risk. And if it can't be eliminated, then how do we mitigate against that risk? And the next thing that they should look at is substitution. So is there a way of avoiding that risk by letting people work from home, for example? Or if you're a teacher, instead of face-to-face teaching, doing it online teaching. And so you go down that hierarchy. And the next one is if there's still some residual risk, is there some engineering controls that need to be put in place? So engineering controls could be so physical barriers, or it could be increased ventilation. So looking at the ventilation, it could be they've started putting these sensors on doors, but they've also started putting people are wearing sort of a watch that says if you're within 2 meters of somebody, it starts vibrating and that sort of thing. But but we're looking for proper engineering controls, which are about collective controls. And then just to say that the next one down is administrative controls. So in our workplaces, it should be looking at communicating risks and rules, limiting occupancy, so how less people in the area. We should be looking at improved cleaning, improved hygiene, all those sorts of things. And the final stage in the hierarchy of controls is PPE. So they shouldn't go in first and say, well, we'll give you all masks or you all wear face coverings. They should be mitigating against the virus transmission by doing all these things. And then finally, if there's still a residual risk, then it should be PPE, and it should be proper PPE. Face coverings are not PPE. They're not eliminating the virus, not protecting you from the virus. And that includes things like face shields, because as you'll see in a minute, when I look at some of the transmission, way it's transmitted, then you'll see that a face shield wouldn't suffice really in protecting you from the virus. And this is all done as a precautionary approach to controlling the risks. So we should be looking at the highest controls needed to control the risks. First of all, using the general principles of prevention in Schedule 1 of Management Health and Safety at Work regs, which first of all avoid the risks, then evaluate the risks which can't be avoided, then combat the risks at source. 4 is adapt work to suit the individual, etc. So there's a whole host of principles that are behind doing this control of risks. So the next slide, please. And we know now that, well, we knew quite a few months ago, but the government have just caught up with it. Transmission routes of the virus are through direct contact, it's through indirect contact, it's through large droplet sprays, you know, you're coughing and sneezing in close proximity, but it's also through aerosols. And this isn't just within 2 meters. These aerosols hang in the air and they cut across large areas. I mean, we do say the less time you're in an area, the better. Less people in an area, the better. Greater ventilation in an area, the better. And more space is better. So all these sorts of things together will protect you from catching the virus, being affected by the virus. But we have to have all these things in place. So the next slide would is one from the risks of transmission, which is from the HSC website. And so they've gone through different ones. Ventilation's this part of it. And there is some new guidance now on their website on ventilation. So it's worth you having a look at that. But the next slide, just to emphasize. So this layered approach to control the risks. So the first one at the top is about no interventions, and look how the virus is all throughout that area, and not only the person in direct contact with the person with the virus, but the one at the back is just the same. If you've got control of the source, so somebody's wearing a mask at source, then there is fewer virus around. If there's ventilation and filtration, so that's somebody not wearing a mask, but there's still fewer virus as a result of that. Distancing is number 3. So the person with a mask on, they're receiving it is probably better protected, not 100% protected, but better protected. And the one in the background is certainly the same, because that virus is all around there. Improved hygiene does very little really in terms of aerosol transmission. And then all the interventions in place, there's a lot less virus in the air, so a lot less aerosols, so a lot less to get infected from. And then the next slide, please, which is another way of looking at it. So we know we need a layered approach to control of the risks. And this is the Swiss cheese respiratory virus pandemic defense slide. And I think it's a really good picture to show what needs to happen. So the first on the left-hand side is the physical distancing, stay at home if you're sick. Then it's about masks wearing. Then it's about hand hygiene, cough etiquette, then avoiding touching your face. If you're in crowded areas, then limiting your time. Fast and sensitive testing and tracing, which all these sorts of things have been a problem for us in the UK. Ventilation, going outdoors if we need to do air inside, using air filtration. Government messaging and financial support. So financial support for people who are self-isolating or off sick is important, especially for people on low pay or in vulnerable jobs, you know, 0 hours contracts, etc. Then we need all those, we need that in place. And we certainly don't need the Cummins Gate affair that we had, which is providing, which provided a real problem in getting people to understand what was needed, what was necessary to protect each other. And then finally, there's the quarantine and isolation of people that come in the country, and vaccines. And all these things together will protect us and prevent transmission. So our next slide is about mental health, risks to mental health. So we know that our employers have got a duty to control the risks to our mental health. And this again is taken from the HSE website, and it's about mental health and well-being, talking about having regular contact, meetings and calls with people working at home, and about any work issues, talking openly with workers about the possibility that they may be infected. So talking them through some of the situations and the fears that they find themselves in, involving workers to complete risk assessments, keeping workers updated on what's happening, and so they feel involved and reassured, and discussing the issues of fatigue. So understanding, you know, working from home, how you can be more fatigued than working in the office, taking regular breaks, etc. But it's really important that our employers are doing this, carrying out this duty. So the next slide is about stress risk assessments. And so one of the things that is on the HSE website is about using stress risk assessments to make sure that all the stress, all the issues relating to work-related stress are being controlled. There isn't a specific law on stress, but they have this duty, as I said before. And the duty covers, on the next slide, it'll just talk about some of the things that are in the stress management risk assessment, which are demands. So looking at workloads of people, work patterns, and this is inside and outside of work. So it's this, if you're working from the home or working in the workplace, we need to make sure that our management are controlling those risks. So there's added pressures that we're under, and those added risks. Is there increased demands? Because as our work has changed through the pandemic, there's all sorts of differences in the way that we're working. And have they reconsidered or considered all these issues? So the demands on us, the working environment that we're working in, the controls. So how much say we've got in doing our job? Are we being encouraged? Are we being managed properly and supported properly? Is the relationships between each other, because of the issues around new ways of working and some people working from home, the pressures of some of us facing real risks in the workplace. So all those pressures and conflicts that come into our working. Do we understand the role that we have? Is it a different role that we've got now? So do we understand that? And how is the organisational change being managed and communicated? So are our management managing the situation properly and making sure that we're all included and consulted, and we've got a good communication between us? And if they do all this, in normal times we say they should set up a stress steering committee to do it, but it makes them look at all the issues around our work and how that they can manage any stress related risks that we've got. And the next slide. This is taken from the ACAS website. So the ACAS is the organisation that provides sort of advice on legal and employment law. And it talks about spotting possible signs of mental health. So this is aimed at employers. So are they looking for signs of mental ill health? Says not everybody will have obvious signs of mental health problems, but they should be looking for things like people appearing very tired, anxious, withdrawn. Is there increased sickness absence, or people being late to meetings? It says being late to work, because this is, for both inside and working from home. But we should be looking if people are joining meetings late, if there's changes in the standard of work or focus on tasks. I mean, that can be due to the anxiety that people have, but it can be due to signs of mental health problems. Are they less interested in the tasks that they previously enjoyed? Is there changes in usual behaviour? So supporting mental health, it talks about giving people time off, looking at reasonable adjustments, understanding concerns and needs of everyone wherever they work, caring responsibilities. Are there people working at home who've got caring responsibilities? Have they got children that are also at home, or they've got other people that caring responsibilities for that could be isolating, or that they could be keeping safe at home, or anybody that's infected with the virus. So understanding that fear and anxiety. There will be people that are going through bereavements. You're talking about 70,000 people have died in the UK. And that's a lot of people. And, most of us know somebody that's died personally. So, is there bereavements that we need to be aware of? But also things like confidentiality. So when you're working on screens and you're working in homes when other people are about, then there's going to be issues around confidentiality. How do we make sure that people's information is protected? And then the final couple on here is about reassurance and signposting. Have you got in place where people can go to get additional support and help? And also support for yourself. So are we all looking after our own mental health as well? Which leads on to the next slide, which is we've done some work in hazards, and you can go onto the Greater Manchester Hazards website, and we've got some fact sheets on working from home. Hilda Palmer, my colleague, who's done some fabulous work on that, and so she's done a fact sheet, and she's also done. We've done some Zoom call, which she talks about working from home as well, and that's on the Hazards Campaign website. But this is about, we all need to be thinking about our own mental fitness, mental health. So don't be too hard on yourself. We're going to be missing our colleagues. Some of us are not getting enough sleep, and it's really difficult to have downtime when you're working from home, that you don't switch off. So how are you switching off? Are you getting out and having a walk? Are you doing all these things? And where are you working? Have you set up your own workspace, or are you still working on a laptop on an ironing board? I mean, that isn't good enough now. We've been working for months now at home, so we need to make sure that our workspaces are correct. We've got the proper equipment, we've got the right environment, it's warm, it's dust free, we've got proper light, and then achieving good and safe working positions, so adjustable chairs, etc., good broadband, and backup IT support. So that's how we work safely at home. But I think we also need to be aware that a lot of people who've been infected with the virus are being left with long-term ill health as well. And there's all sorts of symptoms, and it's being called long COVID, and it will be with us for years for many people who've got become disabled as a result of it. There are mental and physical symptoms associated with it, and there's going to be a need for reasonable adjustments from our employers. And I think one of the issues and concerns that we have is that a lot of people who've got long COVID will have never been tested, because early on they didn't test people. They didn't put them in hospital, but you can have severe symptoms even though you've never been hospitalised and you've never been tested. And so that's going to be an issue for trade unionists. And so the next slide is just to say we need to be aware that the HSE and local authorities enforcement has been absolutely slashed over the last 3 decades. They've had cuts to about 50% cuts to their enforcement, and these are the people that come round and will inspect your employer, or they will try to enforce the law and health and safety. And because of that, at the beginning of the pandemic, they didn't have enough officers to cover all the workplaces. They didn't have enough resources to do that. The government gave them £40 million, and they set up a private call centre. And those are not trained officers in that call centre. They're a call centre, and on top of that, when workers have been complaining to the HSE that their risks aren't being controlled, then they've had officers ringing them up and just going through a checklist, ringing up the employer and just going through a checklist. So we know there's massive problems with it. So if we ever involve the enforcement authorities, then we've got to have evidence to provide for them, because they're not going to do that groundwork. So what I was saying before about making sure that you've got audit trail of evidence, then have an audit trail of evidence on any issues that you think might have to be escalated. So if your employer isn't controlling the risks, if you've got photographic evidence, that's brilliant, but you need to be aware of, sort of confidentiality clauses in your contracts and that sort of thing. But we need to provide enforcement authorities with the evidence to go to our employers if that's the case, if we need to escalate to them. I've just mentioned a couple of other things on here, is that we did some work with Independent Sage. I don't know if you're following them. On a Friday, they do a broadcast, and they're a panel of scientists and academics who've been trying to put a transparency in what the government have been saying, and it's really good information. And we did a charter with them on what a COVID safe workplace should be, and we think it should be certified. Your workplaces should be certified as being safe before they're allowed to open, and if they have lots of cases, then they should be shut until they're safe again. And so have a look on our website for that, or on the Independent Sage website. And then finally, is just about zero COVID, is that we need to have, we believe that the government needs to follow a zero COVID strategy, and that is about putting in place proper track, trace, isolate, find, track, trace, isolate, and support for people, quarantine people when they come into the country, making sure all workplaces are COVID safe, and having circuit breaks to make sure that all those things are happening. And it'd be really good if you support that campaign. And that's it. So any questions, I'd be pleased to try and answer for you. Thank you very much.
Thanks, Janet. And that was a really comprehensive and informative presentation. And I'm sure many of our reps watching this evening will have found the detail that you provided really helpful. So thank you very much for that. I know we've got a few questions that have been coming in during the session. I see that Dave has arrived in some sort of a sense. Dave, are you able to hear us? Are you there? I think the answer to that is emphatically no. So we'll see how Dave joins. And Dave is the Assistant Secretary who's responsible for health and safety within the TFS, and I know he's really keen to talk to you this evening. So we'll see how he does. If not, we'll certainly give you some updates anyway. But I think you touched on, Janet, on mental health, and this has been a real big challenge for many of our members, and certainly through the COVID pandemic, we've seen quite quite a level of various and different types of mental health challenges that have been out there, and conditions triggered by, as well, obviously the circumstances that we're working and living through at the moment. And I know there's lots of work going on with through many trade unions in terms of that, and obviously your presentation drew that out. But I just really wondered what you were thinking in terms of some of the measures that we talk about in terms of prevention, whether there's any sort of guidance you can give to our reps in terms of, I guess, having dialogue with members in terms of a supportive way, but also in building, I guess, trying to create the right culture within workplaces, because a lot of the stresses that our members do feel is often hampered by the way that the employers are not as sympathetic as what we would always want them to be. And I just wonder if there's any sort of guidance and sort of you can give to help that dialogue and create the right, I guess, environment.
I think we think about it in terms of there being like three issues. One is about prevention of people being made iller if they've got mental health conditions, or being made ill as a result of work. So the stress risk assessment. So what do we need to put in place to prevent people being made ill or iller as a result of work? And that could be because of bullying, or it could be because of workload, or just the way that people are working. And then we need to have a working environment that's really supportive, that people aren't penalised if they go off with depression, or that they that the employer doesn't stop them getting promoted if they've had a period of illness with depression or a mental illness. And the third one is about support, as you talked about, because there are people with severe mental illnesses, and we know that every year, at least, based on evidence from other countries, because we haven't got it in this country, but at least 650 people in work will die as a result of suicide. And that's horrific numbers of people that are dying as a result of suicide. And it's because of, again, because of pressures, because of illnesses, that pre-existing illnesses. But it can be made worse by the way that they're treated in the workplace. And so we need to have in place some system of support for them. I mean, they've talked about mental health first aiders in places of work. And just like any other first aider, you know, the first point of call, but we need to be able to signpost, be able to identify if these people have got issues and signpost them. But I think if we can talk about some of those issues and, you know, that it's more open, then perhaps people will be more able to talk about it. But in my personal experience, you may not show any symptoms whatsoever and be open to die by suicide, and you know, and die by suicide. So I think that's why we need all those other things in place. You know, first aid, mental health first aid's all right, but it's not necessarily the answer. You know, they are part of the answer. That's all. So I think it's everything.
Thanks, Janet. Thanks for that. We've actually had a number of requests. If we could have your slides, there's lots of reps out there that clearly really found your slides useful as well. So if we could have those, that would be really good, and we can forward them on to those that request them. Everybody, there's a question come in, Kathy, in relation to your area of work, which is Capita, and particularly, I think I'd call it as abuse of call centre workers, and I think it's certainly become more challenging, obviously, during recent times. But could you talk a little bit about what's going on in Capita, and obviously what the union guidance is in relation to the abuse that call centre workers are taking?
Yeah, of course. Thanks, Tracy, for bringing me in, and thanks, Janet, for your wonderful presentation. I mean, I think you've encapsulated so many things there. You've actually made health and safety quite interesting for me this evening. So, not being facetious, but some of it can be, quite dry, I guess. But when we're talking about mental health and the impact that COVID has had, certainly it's had a massive impact on our customers' behaviour, and B, on obviously the impact on our advisors, because we are constantly and consistently now hearing about abusive calls from customers, which unfortunately within the world of Capita are not being dealt with correctly, because the process is not very good. It's certainly not fit for purpose. It's not robust, and it needs to be changed, because for me, one abusive call from a customer, and don't get me wrong, we're all going through a situation where you've got to wait for an hour to get through to speak to somebody about your issue. I get that. I absolutely get that. But that is not the person at the end of the phone's fault, is it? And we don't have anything. I mean, even a simple thing like putting something on the automated system to say, that, like you have in the doctor's surgery or even in the dentist, to say, any abuse to our staff will not be tolerated. And absolutely, as the CWU, we take a zero tolerance approach to any abuse to any of our members, any of our staff in any way, shape or form. So for me, there are so many simple things that we could put into place initially, albeit, I'll be honest with you, I've taken it upon myself to write an abusive calls policy, and I've based it on what I've seen from BT. Obviously, it's only in a draft format, but I feel so strongly about it that I had to do something, because the managers are not taking it seriously. It's getting to a point where, even if they are dealing with it, which invariably they're not, people are reporting it. And because it's not being dealt with, they're not reporting it anymore and sort of accepting it almost. And I think it's absolutely shocking. And of course, that behaviour is impacting on their mental health. So, I guess for me, it's about calling it out, and it's about trying to deal with it. And, as I've mentioned previously, the other ladies on this call will know that what I would like to do is do a cross union campaign to absolutely out this behaviour and stop it, because one call like that for one person is one too many for me. So thank you, Tracy. I hope that's given you some background on on where I am with this. But yeah, I feel incredibly strongly, and I know it's in BT, it's in Santander, it's in Telefonica. It's in all the businesses that we touch, and also the unrecognised areas. It's everywhere. It is industry wide, I'm afraid, within the call centre environment. So thank you, Tracy.
Okay, thanks, Kathy. And I think that we recognise it's a long-standing issue in terms of certainly if you think of telephone operators historically, it's something that's gone on for quite a long time. And the key thing that we take from this is that having the right policies and strategies with the employers to protect those call centre workers is absolutely key to minimise the risk to people when they're at work. And I think we need to continually challenge that and obviously seek to improve where we need to do so. We have got a question that's come in, and do obviously send questions in, and we'll hopefully answer them as many as we can this evening. There is a question that's come in regarding Openreach, so Julia, I'll be looking at yourself, but there's a question come in regarding the situation with engineers going into domestic properties, and a lot of pressure being put on those engineers to do so, where in essence it's almost like going into a supermarket is how the question is. So I know we've put a lot of guidance out, and I know the Openreach team have in terms of personal risk assessment, but can you just take the opportunity just to reiterate and re-emphasise our position on that?
Yeah, I mean, we've reiterated on numerous occasions, particularly about people's personal risk assessment, and if anybody doesn't feel safe at any point, we have said all along that we will back anybody who says that they need to stop the job, make themselves safe, contact managers and remove themselves from the situation. So we have on numerous occasions and repeated that message. We also understand, though, we're realistic enough to know we've had a lot of feedback. For anybody who knows, as part of the campaign in BT that we've had, the Count Me In campaign, which is obviously far-reaching, but we did email out to all of the Openreach members and ask them to feed in concerns that they had, which again covered the whole spectrum of issues, but health and safety featured very heavily in the responses we had. We had hundreds, more than thousands of responses back from people calling out various issues, and a lot of them called out safety issues and the service pressures, this sort of service above safety mentality. No matter what the company, BT, Openreach, say, that they put safety first. There are numerous examples out there. Not that BT aren't complying, because they have been very careful, and with our support made sure that they've complied. But there's a difference between complying with guidance and that sort of subtle, sometimes not so subtle, pressure on people to put service first. And human instinct is, all of our members, BT Openreach employees, they are good employees who want to put the customer first and want to do a good job. And it is very difficult at times not to bow down to not even the company pressure, sometimes their own personal pressure to do the right thing for the customer. But we have to stress over and over. And the presentation, it was very loud and clear in the presentation we've just had. We are on a bound to point out to people that safety has to come first. Them going home at the end of the day to their families, safe and well, is far more important than any service pressures. We have tried to make sure that everything is in place, that the questions that customers are asked before they enter the premises to make sure they're safe. But we also know that there are a number of situations where our members are telling us that they're still not comfortable. We would ask them to follow all the guidance, all the PPE, all the face coverings, everything that is going to keep them safe. They insist upon it, and if at any point they feel that they're being put under pressure to do anything else, they flag it up instantly, and we will back them all the way.
Thanks, Julia, for that. Hopefully that will deal with the question. I just want to come to Debbie because, I mean, Debbie, you work in Santander and deal with the company on a regular basis. And I know that there's been a lot of dialogue in terms of the situation regarding COVID and how the company's responding to COVID. So I just really want to just take the opportunity, if you can just give us an update in terms of sort of the headlines in Santander for your members.
Yes, thank you, and good evening, everyone. I mean, this pretty much relates back to what Kathy was saying about the customer abuse. I mean, customer abuse has always happened, unfortunately. It's a fact of life. But during the pandemic, people are under much more stress, and so it's happening much more frequently. And Santander has always had good controls in place and support, but what they realised quite quickly was that people needed to access the support differently once they were working from home remotely, and 80% of their contact centre workers are now working from home. And so when you've had a really difficult abusive call, in the past you probably took a break and had a chat with your friends and had a bit of downtime and chatted it through. But of course, when you're in your house, you haven't got that immediate support. And so Santander quickly drew together all of their resources into one place so that people can quickly access it on their computer. The sort of support like help with dealing with difficult customers, the reporting procedures for reporting abusive customers, because Santander won't tolerate abusive customers and will act. Access to the employee assistance if people want to telephone them for support, if it's affecting their mental health, signposting other mental health support such as Mind. They've also made sure that all of Santander's employees have free access to an app on their phone they can download called Thrive, which gives them resources such as help with meditation, mindfulness. They can join web chats with mental health experts. All of these resources are immediately accessible. They can still chat through their issues with their line manager if they want to, but some people, perhaps don't want to do that straight away. They want to try and, help themselves. So this is a brilliant resource for them. And we think, it's working pretty well.
Thanks, Debbie. I think that's helpful. It gives, obviously we do get different approaches from different employers, and I think it's good always to reflect upon that. Kathy, did you want to come back in?
Apologies to Debbie because I'm so delighted and thrilled with the approach that Santander have taken on this one, and I think all of our every employer that we deal with can learn something from this. It's absolutely brilliant. It's at one click and all the links are in one place, and like Debbie says, if you want to do this, you can do this. If it's this that you want to deal with, you can do this. All the information is there, and Santander have provided it wonderfully, absolutely in response to, and I guess it's about understanding what's happening for these people that are out on the floor doing these jobs, and being abused, whereas in my world, and absolutely we've shared this as part of the executive, and, I absolutely take from what Santander have done, and let's try and, get something into place within my workplace. Because as I've said, this goes nowhere. There's not even a robust reporting process for this type of behaviour. So, in fairness, customers are really getting away with it, at the moment. Dealt with a case, I'm a local officer as well for our union, and I dealt with a case a few weeks ago where actually, before it had even been investigated, the case, and I guess thank God for us and for the union for my support in the case, because I dread to think where it would have gone. But the person had been hung, drawn and quartered before there'd even been any form of reasonable investigation into it. And not only, but also before this investigation had gone ahead with the advisor, the customer had been given a massive bill shock credit. You know, they paid him back and said, "Oh, we're really sorry, Mr. Customer, that, you know, the advisor considered that you were a racist." It was quite shocking as to how it was dealt with. So it has to stop, and that's just one small example of the things that that we're dealing with. I mean, another case I'll just briefly refer to, where a young lady. I mean, she was a young lady. She was only 18, and she was abused for 30 minutes, sexually abused on a call, and just still dealt with the customer's query and didn't even highlight it to a manager. And the only reason it came to the attention of the management was because it was drawn out under a call observation. And when the young lady was questioned, she said, "Oh, well, but that happens all the time. And I've spoken to my manager about a couple of things, and it's never been taken seriously. So I just get on with it now." Unacceptable. Absolutely, totally, thoroughly unacceptable in every way, shape or form. And I do hope that everybody will get behind this. And, because I think for me, what that little anecdote says, as it were, it's not a very nice anecdote, but what it says to me is that if we've got people out there thinking that that is okay, that our customers can speak to them like that, and that's acceptable. And because, do you know what, I've spoken to the manager a couple of times before, but they never did anything. That acceptance is absolutely disgraceful, and it has to stop, and it has to stop now for me. So anyway, thank you, Debbie, for your great ideas from Santander. Brilliant. And I love the fact that we're sharing best practice on it. So thank you.
Thanks, Kathy, for that. I'm just going to come to another question, and I'm going to come back to yourself, Janet, only because I think you might like this one. And it's very much talking about the wider issue of the pandemic, and it's phrased as such that post-pandemic there's no health solution really without an economic solution. So we're not paying for it financially like we did for the banking crisis. And I just wondered if you've got any thoughts or comments on that.
Yeah. Well, if we haven't got a health solution, then we won't have an economic solution. It's all interrelated. So we need our employers, we need our government to take our health and our safety seriously. And without that, I mean, you can see what's happened up to now throughout the pandemic. They've tried to rush people back to businesses, back to making money, to pay money to their mates, and actually put our health at risk, and thousands more have died as a result of it. Before the pandemic, we put together a manifesto for what health and safety should look like in view of the cutbacks to health and safety enforcement, and to the lack of and to the way that the government treated health and safety. That they were just trying to destroy it, really. And we'll go back to that. We want to campaign at the end of this pandemic, when we get the vaccinations in and people are safer in our workplaces. We need to go back to a proper health and safety system with proper enforcement of health and safety, and that then, because in our minds, workers' health is public health, and this has shown it up really as the pandemic. As COVID-19 infections, without proper health and safety in our workplaces, then we're infected in our communities, and workers' health is put at risk, and public health has been put at risk as a result of it as well. So we need to make sure, and until the next pandemic, by the way, because this isn't going to be a one-off, there's going to be more in the future. So we've got to make sure that it's right, and without that, then we're not going to have an economic upturn, and certainly workers shouldn't be paying for what's happening as a result of the pandemic. It should be, we've borrowed trillions to pay off banks, and certainly we shouldn't be expecting low-paid workers or workers of any pay to be paying for it, and especially our public sector and our essential workers who've been on the front line of the pandemic all the way through it, to say you can't have pay rises and you shouldn't be getting a pay rise. We need proper pay for workers, to improve things. Can I just mention one other thing though that just came to mind when Julie was talking before? We've got to view everybody as having the virus. That's where we start from in our workplace to controlling the risk, because you can be asymptomatic and showing no symptoms whatsoever. You can be symptomatic but have hardly any symptoms, and you're pre-symptomatic where you're just starting. So everybody that we come into contact with, we've got to view as having the virus, and that's why we need a precautionary approach to controlling all the risks. So when workers are going to people's houses, they've got to know that those risks are properly controlled, that ventilation is properly being controlled, that people aren't being put at additional risk. Thank you. I hope that answered the question, by the way.
Thanks. It did for me. I'm sure we'll find out if it didn't. But I think that's really useful. And we've getting lots of questions in terms of the risk, in terms of people carrying out their roles and responsibilities. And I think it's natural that people are quite cautious and quite frightened and continue to be so during the pandemic, so I think that's absolutely understandable. We have had some questions in relation to the use of face masks, which obviously there are different employers are giving lots of different guidance out in terms of the use of face masks, and there's lots of information out there as well in terms of the type of face mask, the type of protection that we can wear, and whether it's valuable or not valuable. And Janet, I just would really appreciate just sort of the up-to-date information that you have on this, because I think it would be useful to our reps out there in terms of talking with the members.
So our position has been, I think, from nearly the beginning, that because of the risk of transmission, risk of infection from the virus, then if that residual risk, when they've gone through that control hierarchy, if there's still a residual risk, then it has to be answered by PPE, and proper precautionary standard of face masks, and that as an FFP2 is the lowest that we think that workers should be using. FFP3 if you're a health worker, it's an additional. So we were stopped from using them at the beginning. It was certainly discouraged from anybody asking for them because of the shortage of them and the fact that our health workers needed to have it. We didn't have them in the care homes, but our position hasn't changed. That if there's a residual risk, so you're not working on your own, you're working in a big area, lots of people, and that the ventilation's not there, the air isn't being filtrated properly, then you're at risk of contracting the virus from aerosols, and therefore you need an FFP2 level face mask really to protect you. It's not popular stance, I don't think. In many workplaces, our employers would have to buy them and have to pay for them and have to provide them and proper fit testing them. There needs to be all sorts of other controls with them as well. And instead, they're encouraging people to wear face coverings, which are not precautionary. I mean, you can understand outside in the open air that, or in where people are not enclosed or only in areas for short length of times, perhaps in supermarkets and things. But I tell everybody, if you're on public transport, you're going into supermarkets where there's lots of other people, then you need a proper precaution level of face masks, and that's an FFP2 in my mind.
Thanks, Janet. I think that's really helpful, and hopefully that will, assist our reps in having those conversations, because they do lots of questions come in on the use of face masks, and often not helped by sort of conflicting government sort of positions on this as well. But I think a lot of this absolutely demonstrates the need for trade unions such as ours, to continue campaigning and continue fighting on all the health and safety fronts that we do so, because the situation that we've gone through clearly demonstrates the absolute need for union safety reps within workplaces, and certainly that's been demonstrated over this extraordinary year through the pandemic, and obviously we'll continue to have to do that. And just to say that there's lots of questions coming in, particularly around Openreach, so we're not going to get the chance to answer them all this evening. But what I will do, I'll make sure that we get these forwarded to Julia on behalf of the Openreach team as well, and the health and safety team, and we'll get some answers back to you. I think I've got some of your questions, so we can do that. Just one, I think, final question that's coming in is in terms of I guess the relevance of union safety reps in terms of raising the agenda and, you know, within the workplace in terms of environmental health and safety, and you know, where there's a feeling that in many workplaces that companies don't focus enough on what's, you know, their environmental policies and the work that they do within that. And I just wondered if any of the panel have any thoughts about any of that in terms of the estate where people work in. Nobody's specialised subject, Janet.
Well, I would just say that we've, you know, in part of Hazards campaign, we set up Toucan, Trade Union Clean Air Network. I think year before last now. We've lost a year, haven't we? And you know, and that's looking at environmental issues, that the environmental impact of our workplaces, and you know, really have a look on the website about Toucan. We're a Facebook page as well, and we're just trying to bring wider approach to work, you know, to make wider responsibilities. So when your employer sets up a new building, you know, what is the impact of that new building, not only in the workers in there, but on the environment, but especially on the workers in there. You know, is there some environmental impacts that it's going to have in terms of, you know, people having to travel there by car or whatever, like, you know, but especially now in the pandemic, you know, we're looking at the environmental impacts of that pandemic, and people are throwing away. I don't know if you've been walking and you're tripping over gloves and masks and everything else, but also, you know, this throwaway safety culture that we've got now that needs to be addressed. And it certainly will be an issue that we need to be looking at in our workplaces to ensure that we're not just throwing away, we're not just disposable PPE all the time, like, you know. So, you know, it's a lot of those issues as well.
Thanks, Janet, for that. I mean, obviously, it's an area that I know many of our reps are, you know, wanting to sort of improve what's happening within their workplaces, and it's obviously a greener agenda moving forwards is only for the benefit of everybody. So I think it's interesting times. I think there might be a problem with my audio, so hopefully you can hear me. But we are drawing to a close now. Unfortunately, I know Dave will be really frustrated that he wasn't able to join this evening. But I know one of the things that he did want to say is across the TFSC is to thank everybody and all the union safety reps for the work that they've been doing all the way through the pandemic. It has been, I think, an extraordinary time, and I think it's been an extraordinary time for anybody who's a union safety rep, because their workload and I guess the work that they've normally done has changed dramatically this year in terms of the challenge of certainly carrying out risk assessments, you know, having dialogue with the employers, the queries that have come from our members, quite rightly, on all sorts of various things to do with COVID and the challenge of obviously giving guidance. And I think it's fair to say that it's not something that's necessarily something that any of our union safety reps were ever trained on in terms of when they've gone through all the training, some of it many years ago or even more recently. You know, on behalf of Dave, I do want to extend thanks to you for the work that you've done, and also we know that you've dealt with a high volume of queries and questions over the past what seems like many months, and it has been really stressful for all of you, and and for many of us in terms of dealing with all of that, and some of it is quite traumatic and quite challenging in terms of the things that people have been dealing with. So I do want to thank you very much for that, and thanks obviously for continuing to support us and to drive the health and safety agenda into a better place across all the companies where we've got members. So I do want to thank you for that. I know we are coming to the very end of our session now, and I know there's been more questions coming in at the right at the end of the session, but we will get those questions back to you. We'd like to spend more time with you, but we do have to sadly end the session at some point, and we're coming right up to the hour now in terms of that. But Janet, I don't know if there's anything you want to say just before we disappear, but I do want to thank you obviously for joining us this evening. So you did give a really great and comprehensive presentation, which I'm sure was going to wing its way around the CWU at the earliest opportunity once we get it from you. But I don't know if there's anything you want to just say before you leave us.
Oh, just thank you very much. You know, as I said before, you know, your reps, your union is instrumental in keeping lots of people safe and healthy at work and stopping people dying as a result of that. And, you know, thank you very much for all your support that you give us as well. So good luck, and if there's anything that we can do to help and support any of you, then please just email us, and we'll do what we can.
Thanks, Janet, for that. Okay, just a call out for the Hazards campaign on the website. It's hazardscampaign.org.uk. I think you probably, all those that are watching, will be very familiar with it, but I'm just drawing your attention back to that. And there's a wealth of information on there that I'm sure you're very familiar with. Just want to say thank you on behalf of all the panelists this evening for joining us. I'll hopefully catch up with Dave Dukes at the next opportunity to see how he's doing. And we did miss you, Dave, if you're watching at the moment. But and thanks once again to everybody who's joined us this evening. And thanks for your time. Thank you.